You know, I kind of went through my entire pregnancy with no symptoms.
I was doing very well until 36 weeks. I had all of the warning signs of preeclampsia earlier in my pregnancy, but I didn't recognize that those were the warning signs.
My next pregnancy was 16 years later, and I again developed preeclampsia.
It was a scary situation, and I felt helpless just because my education level was almost zero.
And I thought it was gas. You know, I didn't think it was anything, you know, significant. And I called the midwife, and she told me that, you know, it may be nothing.
My blood pressure went from normal to sky high literally overnight.
My son's heart rate started to drop.
My body got really stiff.
Couldn't get her blood pressure to come down.
My blood pressure was getting higher and higher.
I was having a seizure.
I was put in the hospital 3 days before Alex was born because I was so sick, swollen, and blood pressure high.
They told us, you know, the cure for preeclampsia is delivery. So we're going to deliver this baby, C-section.
That seizure was followed by another seizure as they were performing the cesarean.
Was induced, had the baby, and seemed to be doing well. My daughter was born at 29 weeks via emergency C-section.
Everything was fine, and they allowed her to be discharged.
I was released on a Saturday morning and had a follow-up doctor's appointment on Monday.
The day I was supposed to be discharged from the hospital, I woke up with the most severe, worst headache I've ever had in my entire life.
48 hours later, she collapsed at home.
And the doctor's first question was, "How are you feeling?" And I thought about it and I said, "I've had a headache since yesterday and I can't seem to get it to go away." And she said, "I'm readmitting you." And I had postpartum preeclampsia.
I had developed something called PRES syndrome due to preeclampsia.
I thought she was just having some anxiety attack, you know, difficulty breathing. She just starts to hyperventilate.
Term they use a lot of times for it is leaky brain syndrome. It's basically the vessels of the brain are damaged from the stress of the high blood pressure.
So I just made the decision to call 911.
My kidneys were already damaged, my lungs and my liver had been completely shot.
About 7 minutes after I made the call, she was on the floor and took her last breath as they knocked at the door.
She spent the first 56 days of her life in the NICU.
I thought I was gonna die. I really thought I was gonna die.
I struggled watching my daughter fight for her life in the NICU, and I felt helpless.
So they immediately came in, started working on her. Couldn't get a pulse. Never got a pulse.
It took me about 4 months before they would release me from the hospital. My follow-up care was dialysis. I remained on dialysis for about a year.
And if someone had educated me at the beginning of my pregnancy that this is preeclampsia, I think the outcome might have been somewhat different for us.
I remember being angry that I didn't know much about preeclampsia.
And so, yeah, preeclampsia was definitely one of those things that kind of snuck up and just changed my life.
So I feel like sometimes women that have heard about it, it's kind of like, oh, you just had some high blood pressure, and they don't realize how dangerous it can be. It can be life-threatening to them or to their baby.
I've met a lot of women since my diagnosis and recovery who didn't get the same follow-up care. And it's made me realize just how lucky I was that my doctor did send me for that follow-up blood work and did call me back in to say, "How are you feeling?"
And all along, they kept telling us that the cure for preeclampsia is delivery. So as far as they were concerned, as far as we were concerned as patients, once she delivered, everything was going to be okay.
Thankfully, most mothers and babies survive preeclampsia. Tragically, others don't. We need to change that. We need to prevent preeclampsia because you have a wife, a sister, a daughter, a friend who could one day be a face of preeclampsia. We ask for your donation to this important cause in honor of moms and babies who are among us and those we have lost. Visit preeclampsia.org/donate to support the many faces of preeclampsia.